So we're discussing characterizing medical magnets and exploring mechanisms of action and applications for medical acupuncturists. And as a conflict of interest, I am the owner and developer of Neuromagnetics Australia and the manufacturer of Q magnets. Some of you may have seen me at some of the ICMA conferences. And yeah, so have gained a lot of understanding over 20 years and should find this informative, I hope. So to make the claim that a magnet is a medical magnet would have to meet certain criteria, and that criteria, at least 3 criteria, I would say, would be evidence. You need to be independent published evidence, a rationale for how the magnets work, and utility. And mainly utility in that the benefits outweigh the risks and the expenses. And you also may want to look at regulatory approval and things like ISO 13485. So that would be what we're looking for to characterize a medical magnet. And we're going to now look at different effects from magnets in the physical, the physiological, and the therapeutic, because different magnets and different magnet designs will produce different physical effects, different physiological effects, and different therapeutic effects. And so some of these effects you'll see with ion filings and forces, and we'll look at some of the designs, and we'll look at also magnetic field gradients. So here we see ion filings over a typical bipolar magnet and over a quadrupolar magnet. And here you can see the field lines. And the beauty of ion filings are to a static magnetic field what leaves in a tree are to wind. Obviously, wind is invisible, so are magnetic field lines to the human eye. And so by sprinkling ion filings over them, we can get a visual picture of the magnetic field lines. So here we can see a normal bipolar magnet. We can see the field lines go from the North Pole into the South Pole. Here we have a quadrupolar magnet, and we can see how at the outside we can see it looks like a normal bipolar magnet, where the ion filings are coming up perpendicular, but where the interpole or the opposing pole meets, then the ion filings run flat here. And so they're following the field lines going from the one pole to the adjacent alternating pole. And that's where the most biologically active area of the magnet is right where those alternating poles are. And that's been shown through quite a few different trials and experiments and published research. So here's one design of a magnet, and I'm sure you all have a fridge magnet at home. And if you look at a fridge magnet through a magnetic viewing film, you'll see these lines through it. And what this is what's called the Hallback array. And the Hallback array, if you see in this diagram down the bottom, is the design of the magnet and the orientation of the magnetization, so that the magnetic field, virtually most of it comes out on one side. So if you go home and you remember this, flip your fridge magnet around and try and stick it to your magnet, to your fridge, with the image to the fridge, and you'll find that it won't work, because most of the magnetic field only comes from one direction. So the magnet design matters and the application matters in terms of a fridge magnet. So different magnet designs produce different physical effects. And also you could actually remagnetize a fridge magnet to have a North Pole on one side and a South Pole on the other side as well. And if you did that, it wouldn't stick to your fridge either, because the magnet wouldn't be strong enough to stick to the fridge. So the Hallback array magnetization makes it strong enough to do so. Here's another example of iron filings on a long bipolar magnet. And you can see how the iron filings are very dense at the ends, and the field lines are much further apart along the shaft of the magnet. So if you put nails near a magnet like this, they all stick to the ends of the magnet. The magnetic field's very weak. The forces involved along the shaft are very weak, and all the strength of the magnets is right at the ends there. And that's where the field lines are most dense, at the ends of the magnet. Now we'll look at a long multipolar magnet. And so here we've got the close interaction of multiple poles. And so you can see now the field lines from the iron filings are really hemmed in really close to the shaft of the magnet. And there's very little magnetic field out at the ends there. And then you look at the nails. So instead of the nails sticking at the ends of the magnet, the nails are now really hugging that shaft very tightly. Now, this really matters because there is such a thing as a cow magnet, and in certain areas, there might be areas where cows graze, and there might be bits of metal in the ground, in the pasture, whether it's a barbed wire or a nail. And so that's designed to collect those bits of metal, so in the rumen of the cow, it doesn't puncture the stomach or puncture the rumen. And so if you're a cow, which magnet would you prefer to have in your stomach? This one here, we can see obviously. This one here would almost guarantee a puncture of the rumen. And so again, it's showing that your different magnets produce different physical effects. The design matters. And here now we'll just a brief look at magnetic field gradients. So this is another, when you have the close interaction of alternating poles, you get these stronger field gradients. So here is a dipole in a uniform static magnetic field, and you can tell it's uniform by the parallel lines. And you've got a force on the south pole, a force on the north pole, and they're equal forces. And so in a uniform field, this dipole will just experience a torque force, and it will turn it around to align to the field lines. And so it will just experience a torque. Whereas now down here, we have a field gradient, and you've got where the lines are converging here. So you've got a stronger magnetic field here, a weaker field here. So this pole here has a stronger force. This is a weaker force. So now you introduce a translatory force on this particle. So you do get different effects from magnetic field gradients than you would get from a normal uniform magnetic field. And here you can see a quadrupolar magnet with the 4 alternating poles. And so there's 4 active areas. And here you've got a hexapolar magnet with the 6 alternating poles. So the 6 active areas. And then you get an idea of depth of penetration of different magnets. So these are a neodymium rare earth magnet, which are about as powerful a magnet as you can find. And so the quadrupolar magnet, which is 28 millimeter diameter and 6 mil thick, will penetrate roughly 50 millimeters, whereas a hexapolar of the same size will only penetrate about 25 millimeters, so half the depth of penetration. You don't always need the extra depth of penetration, and so you get 6 active areas in this magnet, 4 there. Here you get 8 active areas with the octopolar, so that's a larger magnet, and that just gives you an indication of depth of penetration of rare earth multipolar magnets. So now we'll look at different physiological effects based on published studies. And these, again, so we're going to look at different magnet design producing different physiological effects. We're not going to look at all of these, but we're going to look at the action potential firing. But there's also studies showing cell membrane stabilization, nerve conduction, and differences in blood flow. And one thing you should know is that magnets do not affect iron in the blood, in the hemoglobin. iron in hemoglobin, whether it's depending on whether it's oxygenated or deoxygenated, is actually diamagnetic or paramagnetic. And those types of magnetic forces are so minute, there is no effect at all. But you often read these when you read people who don't know what they're talking about, even in books and on the internet, you'll often read that it will attract iron in the blood, but no, it doesn't. So here we go, the active area of the magnet we showed before is where the field lines are running parallel with the surface of the magnet here, where the field gradient is strongest. And this now study we're going to look at here was published in 1991. And this is a group of neurologists at Vanderbilt Medical University who looked at the effects of different types of static magnetic fields on when they harvested a dorsal root ganglion. And what they did in this study is they harvested a dorsal root ganglion and set it up in a microscope, and had a tiny little pointer, and they had the cell, and they had a tiny pointer, and with a little bit of mechanical stimulation that would stimulate an action potential on the cell, and then expose that cell to different designs of static magnets, and then see what happens. And on this quadrupolar array, after 3 to 4 minutes, there was complete blockage of action potential firing. And when the field was removed, it took about 5 minutes, and then the action potential firing came back. So stimulate the cell, and it would once again fire its action potential. When you had 4 magnets like this of all the 1 poles facing the same side, it also had a reasonable effect on blocking of action potentials. But immediately when the field was removed, either 2 or 5 seconds later, it started to fire its action potentials again. Whereas this north and south pole together, or just 1 pole, had no effect after 10 minutes at all on action potential firing. So once again, showing different types of static magnetic fields having different physiological effects. And from a lot of the studies that they did, a range of different cell studies, their data suggested that the most likely mechanism is that the field gradients of the quadrupolar array is altering nerve excitability as a result of changes in membrane permeability to sodium and calcium ions. And this is just a much more recent study, 2020. So there's a lot of studies now coming out with transcranial magnetic stimulation, which is for medication-resistant depression, is approved now in a lot of countries. And they're now even doing studies for transcranial static magnetic stimulation. And in this study, they looked at Lorentz force. And so here we have a cell membrane with a sodium channel, and their sodium will flow through the electrochemical gradient through the channel. Now, you may remember from your physics days, here we go. So we've introduced now a magnetic field, and now I don't know if you can see me here, but I'm going to try and do this. So the magnetic field is coming out. You can see the circle there. So the magnetic field is coming out of the screen. So the magnetic field's coming out. It's the current, or the direction of the ion, is coming down, and so the force is to the right. So you can see that this magnetic field will put a force on this moving charged particle, and it will sort of force it into the side of the channel, which is obviously made out of proteins. So that's going to put a kind of more friction on the on that ion moving through the channel, and therefore slow it down. And so this is dependent on the direction of the magnetic field. So this magnetic field here is obviously coming out of the screen. If the magnetic field was moving, sorry, was in the direction through the cell membrane, then you've got this vector quantity here. This is a cross product. So the velocity cross cross product to the magnetic field, and if they're in the same direction, that would be 0. So there would be no force on the charged particle if it moved in the same direction. So it is quite complex, but here is from that paper, they're saying there is a mechanism whereby an external magnetic field would slow down the permeability of sodium through that sodium channel. And here's another mechanism whereby this could work, and this is the proteins in a sodium channel, or the cellular structure, the molecular structure. And in the gate is the amino acid phenylalanine. And that's a major part of the gate, and that's very susceptible to diamagnetic anisotropy. All the aromatics are. And so a sodium channel might be closed, but in the presence of a magnetic field could open or close that channel with that phenylalanine amino acid, and then could also change the cell membrane permeability. So there's it's still not exactly known for sure, but there's a few different mechanisms where that could work that's been published. Now we'll talk about the therapeutic effects of magnets. So we've got pain relief and tissue healing are the two main ones that we discuss here. Look, other acupuncturists have come to me and explained amazing things what they're doing with multipolar magnets in addition to that, but we're sticking here with what's in the published literature. So we're going to look at a case study, a case series, and then some randomized controlled trials. So this was the one published in 2022 in Medical Acupuncture by Dr. Nimzau. Now, here's an interesting background. Dr. Nimzau, his PhD was in cellular potentials, and even in this paper suggests that the static magnetic field may modulate the resting membrane potential of even non-excitable cells. And this is a free, anyone can access this under Medical Acupuncture in the editorial. And that's quite an amazing case study, that one, but I'm not have time to go into it now. Then 2023, last year, was published a case series. And so there were 9 out of 10 cases here which had significant analgesic effects. There were 4 different medical acupuncturists in there to avoid bias. And so that was a reasonably significant case series. And in the way they used the magnets in these instances, they were applied simply as a matter of clinical expediency, and in situations in which the patient didn't have time for an extended treatment, or simply as an alternative approach for patients who had not otherwise responded to one or more of the more common acupuncture-related interventions. And it's often the way with magnets. They often get used when nothing else works, and it's like, well, nothing else works, let's try the magnets, and they still do well often in those circumstances. So now we're going to look at some randomized controlled trials. This was an interesting study published in 1997 by Dr. Valbona, and there's an interesting article you can read in the New York Times, wrote an article about Dr. Valbona. He basically was motivated to start this clinical trial to prove that magnets had no place in medicine, and that was his motivation. So, and he designed a very good trial. It was a randomized controlled trial. They were a group of post-polio patients, and it was only a 45-minute intervention, because one of the difficulties in with randomized controlled trials with magnets is protecting the blind, particularly if the patient is going to wear the magnet home. They can use a paper clip or a scissors or anything really to test, anything metal, to test whether they've got the active or the placebo magnet. So they, in this intervention, they observed the subjects for 45 minutes, made sure they didn't test the magnet. It's a relatively weak magnet. It's a flexible rubber magnet, and you can see it here. It's got alternating polarity, north-south, north-south, north-south poles, and quite relatively weak magnet, only 5 millimeter penetration. But if you're placing this on a trigger point, then most likely you don't need a magnet that penetrates very far anyway. So anyway, in the active group, there were 29 subjects and 21 subjects in the inactive group. And the most painful trigger point was sought on the body. And then they had a standardized way of the VAS score. And so in the active group, the VAS pain score is 9.6, 9.5, and the inactive, very similar. After 45 minutes, intervention, they stuck the magnet on, came back, took the magnet off, reassessed the VAS score on that most painful trigger point, and it had dropped by 5.2 in the active group and only dropped 1.1 in the inactive group. So you look at the P score. So that was quite significant. And they did a few other trials, Valbonne. He had to change his mind, I think, after that trial. Here was another randomized controlled trial using another multipolar magnet. This was published in JAMA 2000, and this was for chronic degenerative lower back pain. And really, it's a flexible rubber magnet is most likely going to be much too weak to have an effect for something like low back pain. And of course, there was 20 subjects in this study. And of course, there was no significant difference, the P score 0.86 between the two groups. So, but you could say you learn a lesson here is that even a multipolar magnet for low back pain with a flexible rubber magnet, quite weak, very shallow penetration, and not really going to get to the area that you want it to. And so the quadrupolar magnets from the neodymium rare earth magnets are going to penetrate deep enough to get to the posterior part of the disc, the nerve root, and to have to get to the target, basically, to have a much greater therapeutic effect. Let's take a little drink here. Here we can also see two different types of sizes of quadrupolar magnets on knee. So we've got medial and lateral placements there. These are a 20 millimeter magnet, and so these are a 28 millimeter magnet. So it doesn't look like a huge difference in the size of the magnet, although from 20 mil to 28, but the depth of penetration is quite different. And so the magnetic field basically just captures a lot more tissue. It envelops a lot more tissue and get deeper into the tissue, into the joint, and so forth. So you're looking at what is your target. If the target is fairly superficial, then a smaller magnet with a shallow penetration will do fine. If you require deeper penetration, then a larger magnet is more important to get the depth of penetration, and also a stronger magnetic material, a rare earth magnet, as opposed to the flexible rubber magnet. And so this was another randomized controlled trial with two configurations of static magnets for rheumatoid arthritis of the knee. And so again, an active, inactive group, but the inactive group in this one was a very weak magnet. So you could say this really was a dose comparison group rather than a true placebo, but they were both statistically significant pain relief over baseline, but not statistically significant between the two groups, although the survey did show that the active magnet was much more beneficial from the survey questions to the subjects than the control. So there you're showing that different magnets and different designs produce different therapeutic effects. And then what's important then is what's the application. It's horses for courses. You put the right magnet on the right indication, and where the magnetic field will envelop the target tissue, and then you'll be much more likely to have a positive effect, a benefit. So soft tissue injuries are some of the really obvious things you'll see when you apply these multipolar magnets. You just see you take it off after a day or two, and you'll see these big white circles underneath where the magnet was placed. And so they're quite significant, great for athletes who play contact sports and things like that. You just put the magnet straight on the area straight after the injury, and they'll have less pain and will heal, recover faster. It's pretty obvious. This was a finger sprain from a Wednesday night football injury here in Australia. And, you know, a small joint just requires a small magnet. So these just require little 6mm magnets on either side of the finger joint. And that was taken Thursday morning, and there's Saturday morning. And the father sent me these photos. He couldn't believe it. His son played no problem on the Saturday. And so we've got the other thing with medical magnets designed for medical purposes. There's a range of different sizes, so you can target different anatomical structures, the strength to achieve the necessary depth. Multipolar magnets, I mean, this is really where virtually all of the promising research resides. The Q magnets have a flux plate as well, because you want the magnetic field going into the tissue. You don't need it coming out away from the body and getting stuck to things. If you walk by your filing cabinet or your fridge, the flux plate helps drive the field further into the body, into the tissue. It sort of shields the field. And these are also in a plastic, hypoallergenic medical grade plastic housing that protects the magnet and gives it longevity. And also, yeah, if you have powerful magnets and they snap together, they can crack and shatter. Bits fly out, can lodge in people's eyes, so they can be reasonably dangerous when you get a little bit larger and the neodymium rare earth magnets. But the plastic housing protects them, keeps them safe, and so forth. And so almost there. So the different placements. There's what we call the Holcomb points, which is the neurologist who pioneered a lot of the research. That's mainly over the anatomical structures, over nerves, over joint lines, and so forth. Your Asher points, and then your acupuncture points, and there's the distal and local, or combination. And so placing then some of the magnets here. So here we have the Holcomb points for elbow pain, is directly over the condyle. And there's some acupuncture points that could be placed. And so here for head treatment, again, placing magnets directly over those areas. Whereas here, you know, often with acupuncture treatments, patients may be coming in weekly, maybe not too much more than weekly. So to sustain the effects of acupuncture, then it would be quite simple to put a smaller magnet over the distal points and leave them on in between visits to help sustain the effects of acupuncture. Just as a personal anecdote for myself, I'm fairly fortunate. I've used the magnets a lot for acute pain, but not much for any chronic sort of pain. But I do suffer migraines. I got hit and concussed when I was 18 playing football. And about every year or two, I would get a really bad migraine. It always exactly the same, blurred vision and a throbbing headache, and then you vomit and it's over. You just can't wait till you vomit because this throbbing headache's going to be over soon. And in the last probably 10 years, I've managed it quite well with medication, a bit of paracetamol, and lie down for 3 or 4 hours. And as soon as the blurred vision comes, I know exactly that's what I've got to do. Well, I caught a flight home, not just last week from the States, and when I was driving home, I could I could see the blurred vision coming. And I thought, oh no, I'm in the car. I could have pulled over to get some medication, but I thought, no, I'm going to try these magnets. I was a bit nervous because you don't want to have to suffer this migraine. And I put 2 over the temples, so that positions 1 and 3, and literally within a minute, I could see the blurred vision disappearing. And over the drive home, when I got home, there was no more blurred vision. I just lied down for a little bit, and you know, not long at all, and the migraine never came on. And so that was just, I have very few anecdotes, but that was a great anecdote that I've only just come across, which is nice. So the other thing is we do have placebos we've developed, and these have been validated with a small magnet on the back for the placebo, and it's packed with iron on the other side. So and the active, and so we've got special cases and things. So if anyone there is involved in research, would like to look at some research, we have some validated placebos. And I'm sorry I can't be there to answer questions on my booth and so forth. I hope they'll be back there as soon as we can. But there's my personal email, james@qmagnets.com. Our website is qmagnets.com, and for those who want, we have an affiliate in the Netherlands there, qmagnets.nl, for a European contact as well. So anyway, it's great to be with you. Hope you enjoy the rest of your conference. Thank you.